So now let's record a relationship that we've developed some comfort in wax. So this is the Denar Bite Registration Wax by Whitmix. One thing I want you to notice is it is already cut out for you to fit around this deprogrammer. And too many times that they don't cut out enough, and this is cut out just right, and I'll show you that on the deprogrammer. The other thing, it may look narrow, but it's actually not. This has a very good width to it to cover the teeth. So, and I'll show you that as I place it in initially. Notice how it's overextended buccally. So it gives us plenty of room to trim this to fit our patients, whether they're small or large. So let's go ahead and we're going to heat this up and fit this in the mouth. And notice we don't have to heat the whole thing. You could use a water bath if you wanted, which works very well, but I tend to want to keep the middle a little bit firmer, so I heat just down the sides. We're not trying to capture the anterior teeth with this. We're trying to just capture the bicuspids and the molars. And notice how you want to heat it a little slowly. Don't heat it too quick or it'll start dripping. We want that heat to soak in a little bit. We want it nice and soft, but not running. We can see how it changes color slightly when it gets a little bit warm to the level that we want, and that takes a little bit of practice. So now we're going to bring it over here, and one of the first things we're going to do is just fit it to the top teeth. Right distal to the cuspids. Okay, you know how to hold that. Jaw relax gently. Close slowly and just keep closing. We're going to close right into that index again. Open up. And notice how quickly we can work. So now I have indentations of the patient's teeth. I can take some large scissors like this, cut right down the buccal cusp tips, remove the distal tissue area from the distal of the second molars. And then the lower I can even angle out slightly to get rid of some of that excess there. And if I have to, I can reheat it a little bit, but a lot of times we don't even have to reheat it if we work quick enough. Very nice. Slip it right back in. Okay. My assistant will hold it. And Nadine does a really good job here holding that and getting out of my way. Close slowly. Squeeze. Hold it right there. Okay. Don't move. Now, very important step is I'm going to adapt this wax. And notice how nice this wax holds the heat. Notice how it holds that heat so I can come in and adapt that right to those buccal cusp tips. Very nice. Once I have that adapted, I'll use some air to chill it. Open. Then I'll snap this out and actually float it in a cup of water. A chilled water, not ice water. Just cool room temperature water, and I'll let that float a few minutes to really chill, and then I'll go back and verify it in the mouth. So you can see how we've got nice just cusp tips again on this. This deprogrammer allowed her to not bite too deep, so I didn't have to do a lot of trimming on this case. We'll slip that back in. The first thing I'm going to check is it solid on the upper arch? It's solid. I'm not getting any rocking. Nadine's going to hold that again. And I'm going to go close slowly. And I'm going to feel if there's any deflection, if there's anything hitting before she gets into that index that we developed earlier. But now we're finished. You can see how quick and easy it is to take a wax bite in this fashion. Open up. The nice thing about a wax bite that I prefer over the bite putty is the fact that it's cross-arch stabilized. If you have two pieces of putty, they can shift a little bit laterally. This is cross-arch stabilized. Also notice we have just cuss-tip contact, and that's an ideal situation for a bite to fit into the models accurately. Now I'll go ahead and float this, and that's how we will store this, floating in water until we're ready to use it. One of the things that I've tried to show today is that the Denar Deprogrammer by Whitmix is one of my favorites, and the reasons for that. But I also mainly wanted you to see how easy it is to use to deprogram a patient who has a occlusal muscle problem, and how easy it is to use the Denar wax to record that centric relation. One thing I feel I should mention, when that wax is used to mount models, one of the key reasons for that wax is that it's brittle. And if that goes on the model and it's forced, it'll break. But that's good because it shows you that there's a problem. Something wasn't fitting right. But once that wax is cooled, it's very brittle. So handle it carefully and be aware of trimming it as you need to so that it fits the model real well and that it doesn't break when you're putting it on the models. But that's one of the keys to using that wax. That's why I like it so much. But again, one of the things I wanted you to see is how quick and easy we can deprogram a patient, capture a bite registration, and use that to mount models that we can then study the case further and decide what needs to be done.